All right, so welcome again to a BCC lecture. Okay, obstructive airway disorders are caused by disorders that limit expiration airflow, and they involve the smooth muscle tone affecting the radius of the airway, the mucosal lesion, and the obstruction due to secretions that affect the airway permeability. The bronchial smooth muscle is innervated by the autonomous nervous system. You know that the parasympathetic nervous system will cause bronchoconstriction and the sympathetic nervous system will produce bronchodilation. The conditions we will include in these obstructive lung diseases are asthma and chronic bronchitis and emphysema that are considered together as chronic obstructive pulmonary diseases or COPD, and these are basically due to smoking. So as usual, here you have the objectives of the lecture. Alright, so asthma comes from the Greek word for panting, which makes sense because it causes chronic inflammation of the airways, making them narrow and more difficult to breathe through. People with asthma can have asthma attacks, which are usually triggered by something in the environment which causes the immune cells to generate inflammation in the lungs, which can make them even narrower, and potentially this can be life-threatening. So if we take a look at the lungs, you have here the image. You've got the trachea, which branches off into the right and the left bronchi, and then continues to branch in thousands of bronchioles, like you see in this pulmonary tree. In the bronchioles, you've got the lumen. You have it represented here on top of the lower image. The mucosa, which includes the inner lining of epithelial cells, as well as the lamina propria, and the submucosa, which is where the small muscle lives. Okay, here you have it. You know, that tiny shape of smooth muscle. Okay, so the molecular pathway that leads to asthma is actually pretty complex, but it is often initiated by an environmental trigger. In asthma, there is often an excessive reaction from type 2 helper cells against a specific allergen. Th2 cells are an immune cell subtype, you already know it, which are known to be involved in asthma as well as in atopic dermatitis and allergic rhinitis, making up what is called the atopic triad. What can happen with asthma is allergens from environmental triggers, very well known is the cigarette smoke, are picked up by dendritic cells, which are antigen-presenting cells. Here you have them. They phagocyte the allergen and then present it to a Th2 cell. This in turn will produce cytokines like IL-4 and IL-5, leading to a number of features of asthma. For instance, IL-4 leads to the production of IgE antibodies, which coat mast cells and stimulates them to release granules containing substances like histamine and leukotrienes and prostaglandins. IL-5, on the other hand, activates eosinophils, which promote an immune response by releasing more cytokines and leukotrienes. And going back to IL-4, in this case you see that IgE are produced, so this is an example of type 1 hypersensitivity reaction. This is going to lead to two series of events. Early on, that's minutes after the exposure to the allergen, smooth muscle around the bronchioles starts to spasm and there is increased mucus secretion. Both things are going to narrow the airway, making it difficult to breathe, and this is why asthma is considered to be a type of obstructive pulmonary disease. There is also an increase in vascular permeability and recruitment of additional immune cells from the blood. So a few hours, that's the late reaction, a few hours after exposure, these immune cells, especially eosinophils, release chemical mediators that physically damage the endothelium of the lungs. So initially, these inflammatory changes are completely reversible, but over the years of irreversible changes, that let's say like edema that is producing inflammation, scarring for after reparation, and fibrosis built up, this leads to a thickening of the epithelial basement membrane, which permanently reduces the airway diameter. All right, so although the specific causes of asthma are not well known, it is thought to be caused by a combination of genetic and environmental factors. So this is because certain genes have been identified that increase the risk of developing asthma, and also having a family history of asthma seems to increase the risk. Also, there are medications like aspirin and beta blockers. You know that patients with cardiac conditions take those beta blockers. They have also shown to trigger symptoms in some individuals with asthma. And for environmental factors, there is also the hygiene hypothesis, which suggests that the reduced early immune system exposure to bacteria and viruses may actually increase the risk of later developing asthma, possibly by altering the overall proportion of immune cell subtypes. So in general, causes of childhood asthma diagnosed before the age of 12 are thought to be due to a strong genetic influence, while later onset of asthma is more likely to be related to environmental factors. Now, the triggering substance that leads to the asthma attack can differ from person to person, but some common ones include air pollution, like cigarette smoke, we already mentioned, and car exhaust, especially in cities where there are more cars, as well as allergens like dust, pet dander, cockroaches, and mold, which develop in moist areas. Okay, that said, symptoms of asthma include coughing, a feeling of chest tightness, dyspnea or problems breathing, and wheezing, or also they are known as high-pitched whistling sound that usually happens during exhalation. Occasionally in the sputum, you can find Kurschman spirals. These are spiral-shaped mucus plugs, which are basically elongated mucus casts from small bronchi of people with bronchial asthma. These mucus plugs can be especially dangerous because they not only block exchange of air, but they also block inhaled medications from getting to the site of inflammation. The diagnosis of asthma is based on anamnesis, physical examination, and laboratory findings like any other disease, but here lung function studies are very important. So we have a spirometry, which is a device that can measure the forced expiratory volume in 1 second and the peak expiratory flow rate both of which measure the amount of obstruction of the airway. And to do so during an attack, if you want to measure these parameters during an attack, the attack can be provoked with cold air or histamine respiration. Okay. So now asthma can be classified according to the frequency of the symptoms, in particular nighttime and early morning symptoms, and also a person that is using asthma medications, we may ask how frequently they are using those medications. From least to most severe types of asthma, we have intermittent asthma, mild persistent asthma, moderate persistent asthma, and finally severe persistent asthma. Okay, while there is no cure for asthma, you know that, but there are treatments available that can manage the symptoms and prevent the development of an asthma attack, which can be very dangerous. So first, people with asthma should avoid or minimize contact with triggering substances by vacuuming, removing carpets and rocks, and changing their environmental conditions, like, for example, drying out a room in the case of mold formation. There are also a number of medications that can reduce the symptoms of asthma, like bronchodilators. We have in this group short-acting beta-adrenoceptor agonists and anticholinergic medications, which are often provided with the help of inhalers. Okay, these fast-acting medications can cause the smooth muscle in the lungs to relax, and therefore they delay the airways and they open the radius so the person can breathe, not normally, but can breathe at least. In the case of individuals with more severe forms of asthma, we may need additional treatment like daily corticosteroids, long-acting beta-adrenoceptor agonists, and leukotriene antagonists. And in very severe cases, we can use intravenous corticosteroids, magnesium sulfate to minimize inflammation, and oxygen therapy to help increase saturation of the blood, saturation of oxygen. All right, so to finish, and regarding severe asthma attacks, have in mind that they have become quite frequent and that they may evolve really fast, causing dysrhythmia or suffocation and therefore killing the patient. So never ever underestimate an asthma attack in your clinic or on the street, wherever you are. Okay, that was the last warning. So that's all for asthma. Thank you very much for listening.